The Rook BKA Rigid Dressing with Soft Interface is a dressing designed for immediate use after a below-knee amputation surgery. The Rook BKA dressing provides superior protection to the residual limb and maintains the knee in a neutral position, with the patella immobilized to reduce the risk of flexion contraction. The entire dressing also features Osborne Medical's famous 100% polyester fleece to maintain optimal temperature of the healing limb. The Rook BKA Rigid Dressing with Soft Interface is a universal fit. There is no right or left, and it is designed to fit most if not all patients, despite leg girth or residual limb length. To fit the Rook BKA Rigid Dressing to a patient, first completely open the dressing by undoing all straps and hook and loop closures. Place the patient's leg in the dressing so the patella is placed directly in the middle of the device. Included with the Rook BKA dressing are 2 foam spacers. Use the foam spacers on the distal end to keep the patella directly in the patella window. Generally, one or none of the spacers is enough to orient the patella in the correct location, but a second is provided for patients with a particularly short residual limb. Once the spacers are correctly placed, bring the tongue of the dressing up and secure it by closing the distal flaps. Included with each Rook BKA dressing is a pair of scissors that you may use to trim the flaps according to the patient's leg girth. Cut in between the double stitch lines on the dressing flaps rather than folding the material. This will prevent irritation on the healing limb and assure the fit is secure. Once the optimal circumference is achieved, secure the flaps over the residual limb. Next, secure the proximal straps over the patient's thigh. Again, use the scissors to trim for a more slender thigh. However, if you have a patient with a leg whose girth is exceeding the proximal or distal flap, locate the extender and attach it to the flap, extending the reach of the flap. You should now see the patient's patella located directly in the patella window. Adjust the dressing as needed until the patella is located squarely in the patella window. Then hold the patella pad with both hands on either side and bring down directly over the patella. Secure with light to moderate pressure. Do not secure too tightly. Lastly, close the straps with the buckles and pull or loosen the straps as needed. You may want to check again that the patella is located correctly. Simply undo the hook and loop straps and remove the patella pad completely from the dressing. Reattach by gently placing the patella pad over the patella with both hands. If the patient needs to be in a standing or upright position, attach waist belt, which is included. First, fit the belt around the patient's waist, using the buckle and adjusting the strap. Then attach the tail to the outside of the BKA dressing. This will prevent the dressing from slipping down the patient's leg. Notice that the spacers placed in the distal end of the Rook BKA dressing also provide excellent protection of the residual limb in the event of a fall or impact on that limb. For more information, questions, or to schedule an in-service, please contact Osborne Medical at www.osbornemedical.com or at 800-535-5865.